Hi guys, and welcome back to my channel. For those of you who don't know me, my name is Walisa. I am an emergency medicine higher specialty trainee, and today I'm here to help you prepare for your upcoming ST4 interview. I actually took the ST4 interview twice. If you know my story, I posted earlier with regards to why I had to take it twice, and both times I scored really well on it. So I just wanted to give some tips on how to prepare for the interview. First off, relax. So this is a relatively straightforward interview. There is nothing on the interview that you don't know or that you cannot handle. So relax and don't stress yourself out to the point where you can't perform as you normally would. As you're aware, it's a 30-minute interview that's done via panel, and it's all done online via they have a very specific online portal. So first, let's go through the stations. There's 3 stations. The first station tends to be a clinical or ethical scenario. Of course, you can get it in whatever order. The second station is going to be prioritization, and the third station is a communication station. So let's start with the easiest. So probably the easiest one is going to be the clinical or ethical scenario, just because by the time this level ST3, ST4, you're more clinically adept with regards to emergency cases. Common things are common. We can handle a lot of the emergencies. So it's any exam, verbal exam, you always address your ABCDEs. Also remember that you're going for higher specialty training, so they're not only assessing the basics as they would have done from your ST1 interview. Now they're looking to take it a step further. So in addition to doing your A to E, what else would you be assessing in a patient? For example, would you be assessing with regards to capacity? That's one that comes time and time again. I got that even when I did my OSCE examination. There's always some question on does the patient have capacity, or there might be an issue with regards to confidentiality. So I would just look at resources centered around making sure to understand what the tenets of capacity are, confidentiality with teenagers and parents. I think those are some of the key things that would be important to cover for that station. And then just to, in addition to whatever clinical scenario you're given, just to consider the big picture. An elderly patient, so the big question we ask ourselves: who do they live with? Are they safe to be discharged if you are planning a discharge, and scenarios like that. The second one, let's talk about prioritization. Prioritization, you'll be basically given emergency department, and they'll tell you about different patients who are waiting to be seen and the team that you have. So once again, it's organizing your thoughts. And if you've ever led a department, the first thing you want to know is what are your staffing like, who's available, because it'll determine the skill levels that you have on the department floor to see different patients. So you want to know who your team are, what their skill mix are, so that you can delegate them to different areas. You want to know with regards to capacity in the department, what is your flow looking like? Are there spaces coming up? Are they pending discharge? If they're not pending discharge, then you can consider stuff like reverse queuing. What's common nowadays in our department is that we have patients who've been there for a really long time. If that's the case, can you move them to a less visible area and move other patients into that visible area? So you want to know what your department looks like in terms of space. So how much resource space do you have? How many trolley space do you have? What does your waiting room look like? Do you have ambulance that are queuing outside? If you have ambulance that's queuing outside, also consider that it would be very good practice to have someone, either yourself or someone else, who would be able to just go and assess those patients from the bedside, that they are safe to remain there until there's space for them to be brought in the department, because that's another area where you have a potentially high-risk patient who has not been seen. So you know your members, you know your departmental capacity, you might be asked to prioritize clinical scenarios, and with any prioritization of clinical scenarios, always go back to your A to E. Of course, your airway patient is always going to be more important than your breathing patient. Well, you know what I mean. Of course, it all depends on the scenario. Or don't forget to mention making sure that your teammates have had a break. 5, communicate with the nursing staff. So all these are things that you should be saying with regards to your prioritization station. Yeah, I think that's it. At this point, if I think of anything else, I'll pop it into the description box below. And then finally, the communication station. This station I found a bit difficult just because you are expected to communicate with someone who is online, so you don't get that human to human feel. Basically, to prepare for this station, one of the resources I read and listened to was the podcast from the St. Emily's blog on Breaking Bad News, or well, that's not the exact title. I believe it's Communicating Bad News. Anyways, I'll put it down in the description box below. I think it was really helpful with regards to how you approach breaking bad news. And yeah, I think it just comes back to, breaking bad news early, apologizing for whatever's happened. Let's say there's been a mistake that's happened, apologizing early, talking about what you can action. Of course, it all depends on the scenario. And my 4th point is always giving the person space to express their emotion and offering an empathetic ear. I think that's very important with regards to these communication stations. This video is really helpful with regards to score highly on your interview and getting you to the next level. So good luck, everyone. Bye.